So I must say that autism is a puzzle. You know, 30 years ago when you were just telling people what kind of work you were doing, and you told them that you were a psychiatrist involved with many other disciplines in autism, they looked at you as if you were talking in Chinese. There was no awareness of what autism was altogether. The awareness has increased, of course. Movies like Rain Man, books from Oliver Sacks have raised a lot of awareness as to what is autism. But in the professional public, doctors, hospitals, things like that, you still see that many people have a very stereotype picture of what autism is. We get referral letters of people that say, well, the parents say this child could be autistic, but I've seen the film Rain Man, and he's by no means like Dustin Hoffman in that film, so I really doubt if he's autistic. And that's the difficulty, because it's a phenomenon, it's a behavioral phenotype. And it's a behavioral phenotype that's very different. You know, we know from the days from Lorna Wing that the problems in the development of social reciprocity can present in such different fashions. They can present in aloofness, really not engaging in any form of contact, but they can be active and odd. And it's very difficult for some people to realize that the bottom line is that the similarity between aloofness and active and odd is there's no reciprocity. It's one-sided contact. People with autism are very eager to be in touch with other people, but they do not have the means because their information processing is too slow or too different. And that is something we do not really acknowledge. When we realize now how much better we can communicate with verbal people with autism spectrum disorders, for instance, via the email, but that the pace of that conversation is by no means as fast as the social talk that you would have with someone in a brief encounter. But the bottom line is we have no biological markers. So it's very, very difficult to say this is a case and that's not a case. My colleague and friend Simon Byron-Cohen will be addressing this Congress about the extreme male brain, but he introduced a new term in the sense that he talks about autistic conditions, which are, well, somewhere between normality and psychopathology, and then autistic disorder. And we know that many people with autistic conditions can be extremely successful. We know that there wouldn't have been any computer technology hadn't it been by the virtues of people with autism that were so digital in their thinking that they enabled us to have these slide presentations that you can change any moment, that we can communicate through the email and things like that. It would have been very difficult if and unthinkable that those systems could have been developed by people that had more an analogous and very social way of thinking. So there's some beauty and some strength, but it has a other side. This is a graph that you may know because it's been shown often before. This is the tremendous increase of the cases of autism in the state of California. And when you look at 1975, people that really thought that the MMR vaccination played any role in autism said, well, it's very coincidental that it was a very low percentage, say 1 in 2,000, and then all of a sudden there was a huge outburst. But what you have to bear in mind is that until 1980, when DSM-3 was published, autism had no real place on the classification system. So there was no clear-cut definition. There were no definitions for what was a case, what was not a case. But interestingly enough, 1975 is also the year when Ronald Reagan, not one of the most social presidents of the United States, was elected governor of California. And he, luckily for us, happened to have a nephew who was autistic, and one of the first things was that he acknowledged autism as a social handicap and said that the people were entitled to have social benefits. So then all of a sudden there was a difference, because having a diagnosis entitled people to access to services that would be denied otherwise. In autism, one of the big pitfalls is that there's a lot of mythology. When you see the damage that has been done by one article on the effect of MMR vaccination, that in the UK has made that the vaccination rates in the general population have dropped dramatically from 89% to less than 85%, so enhancing the likelihood that children could get measles or other diseases that we had nearly forgotten about. And it took really a long time, nearly 12 years, before the Lancet published an article saying that the first publication was not methodologically sound, whereas we already knew that in Japan, where the MMR was stopped back in 1992, the increase of autism in the population was just as big as in other countries in the world. So there was no evidence at that point of time that the MMR vaccination played any role whatsoever in the causation of autism, but the harm had been done, and it took a long time before that myth was changed. And why did that myth kick in? You know, when you think of the 14th month of life, in normal development, there's a huge change. Children start talking, children start walking, children start playing around, children start discovering the world. So the difference between a typical child and a child that may develop autism in the first 14 months of life is very small. And then all of a sudden, when the development kicks in, the typical children start communicating, start discovering the world, start sharing their experiences, and the child with autism doesn't. So it seems that it was practically normal until 14 months, and then all of a sudden it becomes apparent that there's something wrong. One of the difficulties we have in conceiving how autism is caused is that we're too much neurologists, that we think that a brain has to be broken, and then when there's a defect, a tumor, a bleeding, a clot somewhere, then you can conceptualize that something's wrong, and you know why the brain is not working in the right fashion. But when you talk about autism, it's not the brain in se. We know that the brains are bigger, but that is because there's too little pruning. But it's more the functional pathways that are different. When we talk about autism, we talk about what we call a behavioral phenotype. So we define autism by the characteristics of the behavior, on the social interaction, on the communication level, on the level of restricted patterns of interest and repetitive patterns. And what has been done is a lot of research has been fostered by these behavioral phenotypes, but less visible are the genetic predispositions that in interaction with the womb environment, then we're talking about the first weeks of pregnancy, not of conscious life, may foster epigenetic changes. These influence the wiring of the brain, the emergence of the social brain. The social brain will be strengthened by the interactions with the environment, but if you don't look at other people, if you don't share attention, if you're more interested in objects than in people, then the wiring of your brain is going to be different, and that's going to have an impact on your neurocognitive profile. Excuse me for the spelling mistake there. And that will foster your information processing style. Kind of a scheme as this one that I use over the past years was introduced first by Frith and Morton back in 1994, and the only big difference is that they called this cognitive and then organic, but the biggest difference is that you see that all the arrows are interactions. Development is always interaction. You develop in interaction with the environment social context. And when you see how these developments take place, I want to show you briefly some work by Marieke Langen, and that's on mice. And what you see is that in the development of mice, you have three circuits: the sensimotor loop, the cognitive loop, and the limbic loop. And the experiences the young animal has very much influence the way the brain circuits are developed. And in people with developmental disorders, this holds true too. And what we see then, that is that the overlap between conditions that we at a behavioral level think to be very distinct, that those distinctions are far less obvious. When you take autism in the center, you see that there's a huge overlap when it comes to attentional capacities with ADHD. There's a huge overlap with obsessive-compulsive disorders. There's a huge overlap with what you could call addiction, very stereotyped patterns of behavior that are rewarding as preoccupations, with Tourette and other motor disorders. So our belief that we know that there are very different developmental conditions should be altered by the fact that we know that there's a huge overlap. And that explains that people with autism can have very different features, because if you're more on the, say, obsessive, compulsive, the driven side, you're going to have a different psychopathology than when you're more on the attentional problems. Another very interesting field of development is what we call the connectivity. And the connectivity in the brain is fascinating because over the past 4 or 5 years, we've become aware of the fact that in our brain there are circuits of communication that are faster than you could explain just by the electrical transmission. And what happens is that through electromagnetic fields, when some information comes in, the areas in the brain that are needed to address that question are involved within milliseconds. And that enables us to respond quite quickly and adequately to changes in the environment. One of the big problems is that we see that starting with JUST and a couple of other studies that have been conducted over the past 3 or 4 years, that in autism there's a pattern of what we call misbalanced connectivity. And here again, excuse me, connectivity written like this is Dutch and not English.